defining what the action steps should be. And although, planning meetings, and obviously at board meetings, and the Board of Health has been I think the prime sort of sponsor of this work, even though other groups have been involved. I thought it would be good for us to just, before we meet next week, and really kind of launch into a public process in terms of, what the priorities are and what we should do about them. I thought we should just take a moment, and this hopefully will be a short meeting and a day of hard stop at 7:30. Just take a moment, and I asked Jamie to, which she did, pull together the big chunks that many of which we've seen already, but put it together in a document that we could, look at. Hopefully everybody has read. Maybe Jamie do a brief presentation around that, and just make sure that kind of going forward at this point, we're, all on board with, the data and the priorities and so forth. Because I think going forward, the focus is really going to be on not changing the priorities, not going over the data again and again, but really looking forward to what do we need to do to address it. And so I wanted to have this kind of meeting before next week. I think April 3rd is when we have the CHIP meeting, just to kind of step back and make sure we're all on board with this. So that's the purpose of this meeting. So I'm going to turn it over to Jamie and kind of go from there.
Thank you very much. I'm going to go ahead and share my screen if it's okay. I did put a couple of slides together to help frame just a high level overview of the process. I know some of you have been involved in this from the get-go, but I think it's a good refresher nonetheless. So I'm going to go ahead and hopefully get this going as a presentation. Okay. I'm hoping you're seeing the right screen.
Yep.
Give me a thumbs up if you see the slides.
Yes.
Yep. Great. All right, so just a quick refresher on the process that we've taken. As Dr. Lopez mentioned, it has been a full year, and it is hard to believe that it has been a full year's process. If you recall, we started this sort of journey talking a little bit about what health frameworks make the most sense for Reading. So we centered on the Healthy People 2030 objectives, which is a national plan that focuses on health across the lifespan. And you all also put emphasis on the social determinants of health and really trying to get at the upstream drivers of health beyond just the traditional access to healthcare or presence or absence of disease in terms of a more rudimentary definition of health. And then as a part of our process, we took that information and we started to look at what was available in Reading for secondary data sources. And by that, I mean things that might be available through the Mass population health information tools. So there's some community profile information. They do a really nice job pulling things together for local communities. National sources like county health rankings that look at things at a regional level. And then some of the larger surveillance data sets like the Behavioral Risk Factor Surveillance Survey and the Youth Risk Surveillance Survey as examples of them. From there, we wanted to get a sense of perspectives from the Reading community, so local leaders, residents themselves, and other folks who could really lend their insight on whether it's from their working relationship or living within Reading or a little bit of both. What they see as those leading health needs and priorities. So we conducted a series of key leader interviews, some community focus groups, and then we did a community survey that was distributed within the community, and we received about 200 full survey responses from that process. We took all of that information and started to distill it into the community health needs assessment. So The assessment that you all received ahead of tonight as a draft includes 5 different sections. The first is community characteristics. The second is about social and economic factors. The third is about quality of life and some of the health behavior and health outcome related information. The fourth is about healthcare access and quality. And the last section is about neighborhood and built environment. Again, the sections themselves were designed intentionally to be a little bit more comprehensive than just the presence or absence of disease, but to think about policy systems and environmental change factors that could influence someone's health status. Each section or sort of chapter within the draft needs assessment includes 2 or 3 high levels or like high need areas of interest based on some of the data points from the secondary data sources that I mentioned, and then also just community input and what folks felt might be some of the leading health needs within those categories. The plan itself will conclude with a community health improvement plan section. And the goal of the community health improvement plan is to identify the strategies or the actions you'd like to take to address the leading health needs that have been identified as a part of the assessment process. So that's really where you start to move to action, as Dr. Lopez mentioned. Health needs. We took all of the information from the needs assessment and the 2 or 3 needs per section and did some level of prioritization to come up with 3 priority health needs. That was sort of prioritized and narrowed based on a series of meetings and other engagements that we conducted. So first was working with the planning team to think about what would push a health need towards being applicable for a community health improvement plan, realizing that all the health needs that are identified by the needs assessment are important, but whether or not they should be moved to action within the community health improvement plan was one consideration. We also talked a little bit about the control or the aspect of the local health department and its partners and the ability to move to action on some of the health needs. And then lastly, the improvement potential or the ability to make a large improvement in the area of the health need. We also took all the information from that process and shared it with community leaders, because collaboration, as I alluded to, is incredibly important as a part of this process. The Department of Health can certainly move certain aspects of the work, but public health by nature is collaborative process that requires multi-sector engagement. And so it's important to make sure that the priorities that are selected for the community health improvement plan align with other priorities within the community and other sectors that will be instrumental in helping to move this plan forward. So all that to say, after doing the ranking and talking with folks in the community, we have arrived at 3 priority areas. The first is around preventive health screenings and access to treatment services, and really thinking about preventive health screenings in particular amongst populations of interest, such as those who are older adults that may have lack of access to preventive health screenings. And also thinking about it in terms of mental health and behavioral health services and access to treatment services for those who need those services most. The second area is focused in on healthy environments and inclusive programs. And there's really 3 goals to this sort of category or need. The first is to think about spaces, places, and programs that are designed in a way that they'll meet the needs of people of all ages and abilities. So really centering in on the environmental aspect of a place, but then also the inclusion and the ability to adapt programming to serve lots of populations and make sure that everybody has the ability to participate and engage in what they need to be healthy. The second area is thinking about community connections and supportive services, and this really came out of conversations around a health need, around social isolation and loneliness. The Surgeon General has put out a report recently talking about the importance of addressing social isolation and loneliness within communities. And so the goal here is to build out opportunities to engage folks who may not be able to engage within community, who may otherwise be isolated. And then also think about the access to services and the delivery of those services to make sure they're offered at convenient times so everyone can gain access to what they need most to be healthy. And then lastly is really thinking about youth and young adults and getting upstream to make sure that they have what they need in the way of protective factors for health, to ensure that they have the resiliency and well-being and a sense of belonging within their community that we know helps to produce healthy outcomes in adulthood. The last area is around healthy eating and active living. And really this came back to thinking about healthy behaviors across the lifespan and what we know about healthy eating and staying physically active as leading drivers of health. And thinking about it also in terms of not just programs, but community design. So how do we think about policies, systems, and environmental change strategies to ensure that the healthy choice within the community is the easy choice? So it could be something like a farmer's market to build access to healthy, affordable food sources. All of these areas, as we discussed so far with the planning team and also at Board of Health meetings, is to think about it in terms of diversity, equity, inclusion, and belonging. So you'll notice in the goal areas that it specifically says things like for those who need support. So we'll use this DEIB frame to really distill down what does that mean in terms of who needs access and support to services as they're described within these goal areas, to make sure that whatever's put forward in the way of strategies, that they're equitable and certainly address some of the health inequities within the community. So in terms of next steps from where we sit, now that we have our top 3 priorities and the goal areas, the next step is to really engage the community, as Dr. Lopez mentioned. So the first step will be next week, assembling a community health improvement planning meeting with community leaders, where we'll take a moment to think about existing assets that could be leveraged to support and move some of the strategies within the priority areas that I mentioned, and then also identify what strategies make sense within the community. And I think there's a lot of, I know from talking with folks, there's a lot of assets that could be built on to identify what strategies we should focus on as a part of the improvement plan. So the goal of that meeting is to really pull that forward. The second step is to hold a public hearing sometime in early May, and really get a sense of from the public around their feedback for the types of strategies they would like to see to address those leading health needs, and have the opportunity to listen to the residents around what they would like to propose for consideration as a part of our strategies selection process. And then lastly, it's really writing up all of the recommendations for strategies into a final section within the draft report that you receive. So there's a section under development for the improvement plan, which will include those strategies that are identified, as well as a work plan to guide high-level action steps for year 1, so that Reading's in a position to move forward with the first few initial steps to move on a 3 to 5 year course for the community health improvement plan. And then lastly, it'll be important for you all to celebrate this process as a community, because a lot of work went into it. And so taking a moment to really reflect and breathe a moment and celebrate having a plan by the end of May, early June, that can then be distributed throughout the community. Yes. So with that, I'm going to stop sharing my screen just so that I can see all of you. And I'm going to open the floor for comments, questions, or suggestions from you all in terms of the process, the priorities and or the next steps. Here we go. Paula?
Paula, go ahead.
Just,
I don't know
I'm just so proud of this whole thing. Done such a great job, and it's been wonderful collaborating with you and everybody on the team. And I'm just really proud of this whole thing.
Agree.
Mhm.
Yeah, it's really, I'm sitting here just being quietly proud and happy, and thinking about how much work we've done together and learned since I joined the board back in 2021. It's very exciting, and I appreciate very much, Jamie, your work with us, guiding us along through this, and really enjoyed the thoughtful process that we all have engaged in, trying to make sure that we do right by the town. So this is great.
I would certainly second that. I think the report, Jamie, that you shared last week really is thorough. You incorporated a lot of the suggestions, like things like including the actual numbers when talking about percentages, so that people knew where this was coming from and could take that into context. And I think consolidating the number of priorities to 3 and putting them in a language that I think the average citizen can, understand and relate to was important. And so, overall, I'm happy with the outcome to date in terms of this, community health needs assessment. I think I'm a little anxious about the chip. I don't know how that's all going to play out, but we'll just take it day by day and see what happens. So
We're in good hands.
yes.
We're good problem solvers. So we'll yeah. Good stuff.
Yes. There is a lot of great work already happening within Reading to build on. So even just in the initial conversations I had with some of the community leaders around what those priorities could be, they were already bringing forward, well, this, would work nicely with this. And so I look forward to next week and really putting some of those puzzle pieces together to lift what those strategies are. Because I do think there's a lot already happening that could just be worked within the plan locally for you all.
Excellent.
Kevin? Yeah.
Hi, Jamie. How you doing?
Good, how are you?
Good, thanks. Yeah, I mean, I'll third or fourth that at this point. I think it's an excellent plan, or I should say, a setup for the plan. I just have one question. I noticed a lot of the stuff from a reference standpoint was the 2021 YRBS. Do we not have a more current one than that?
That is the most current version that was available locally,
Okay.
yes.
I just want to make sure that we're using the most current one. Perfect.
Yeah, unfortunately, some of the population level surveys are a couple years behind, just from like a data cleaning perspective and the ability for them to release the results. So yes, it's 2021, but that is the most currently available.
And maybe I probably should have brought this up. I don't know if you did this on your own or not. Did you, by any chance, look at any of our YRBSs prior to the pandemic? Just from comparison standpoint.
I did initially, but I did not pull any of it into the plan from a trend perspective, but I did initially look.
This is pure curiosity on my behalf, Jamie.
Yeah.
More than anything else. So, all right. No, I think it's great work. I think it's going to be well received by the town. And again, I think, Rick, to your point, I'm not as worried about the implementation. This is not a you must do, right? This is a, hey, this is where we're at. This is what you could do. These are things that will be helpful. So
and we're not reinventing the wheel.
Yeah, I think it's going to be a welcomed thing for that matter, if it's given in that light, right? So if it's given in that, means that we can do what we can do. We can't go outside of what we're not capable of. So there are going to be things that you want to do and things that you need to do along the way, and I'm sure it'll work itself out. But I thought it was a great report, really did.
Great. Thank you.
I have a process question. So the document that you shared with the board, that will go out to the people that we're inviting to the CHIP meeting next week. Is that correct? Okay.
Correct, yes.
And at what point, exactly in terms of informing the public in anticipation of that public hearing in May, at what point would you see a document being publicized so that people can actually go to a public hearing and give feedback, because they have to know what they're giving feedback on? I mean, I know what you sent was draft, and I don't know if you're thinking that a report would be released to the public that was basically Thursday's, what you distributed, plus the initial CHIP ideas. Is that the plan, or what are you thinking?
So in terms of process, you all can really decide in terms of what you would like to share ahead of time. I think ideally, the draft document is shared ahead of time so people can see where those priorities were derived and understand some of the data behind the health priorities. It's up to the board whether you all would like to take the notes from the CHIP planning session and the strategies that have been identified and share that with the public for them to consider as a part of their input within the public hearing. And I can see it both ways. You can either do that and ask folks to look at it ahead of time and reflect and perhaps uplift some of the things that have already been noted in terms of the strategies coming out of the community leader meeting that they would like to support. Or you can leave it as a blank canvas and say, here are the priorities from your perspective. What type of strategies would you like to see locally for us to address those things?
Okay. I guess we'll see. We'll have a better sense after April 3rd as to how it should be handled.
Mm-hmm.
Jenny, would you be able to share the draft, please? Is that possible?
Sure. On my screen?
Yes, please. So the way I see this play out is we have that meeting on the 3rd of April. And then can you please scroll to page 26? 26. Yes. So if you look at page 26, it says under development. So if we get the input from April 3rd, we need to put everything in this section. And then we're still going to have a draft document that we can share, have the public look at before the public hearing. That's the way I see it. And then after the public hearing, it's not going to be a draft anymore. It's going to be, we're going to work on it, clean it up, add some things to it, adjust whatever we need to adjust, and then create the final document.
Yeah,
Sure,
I mean, I
that
think that
works
makes
for me.
sense. And as long as we, after April 3rd, and we fill in this space as preliminary ideas. So the public knows that we haven't closed the book. These are just the initial ideas.
Correct. And it's still a draft.
Draft.
Yeah.
Yes.
Okay.
Correct.
Sounds good.
Great. That'll work for sure. Okay.
All right. Any other thoughts, comments, suggestions?
Thank you for calling this meeting. It was very helpful.
No. Okay, well, I think we're ready to go. Motion to adjourn. Do I have a second? Oh. Paula seconded. Roll call, Carrie,
Yes.
Paula,
Yes.
and Rick, yes. Okay, well, thank you all for taking your time and we'll see you next week.
All right,
Yes.
thank you all.
Thank you,
Thanks.
Jamie.
Bye.
Thank
care.
you.
Thanks.
Recording stopped.